Video again, I am discussing recall communications. It comes from Jeddah, January 2023. That is anaphylaxis after sting bite, presented with swelling and rash, shortness of breath. Known patient with asthma, went by ambulance who gave her adrenaline IM and inhaler. On arrival to hospital, was about explanation, the conditions and Epipen and advice. So here explanation of the conditions, that is what is anaphylaxis and Epipen and the advice. Again, it is come on 2019 that Epipen autoinjector and management strategies for anaphylaxis in a child with recent hospitalization with anaphylaxis to CSAME. Also tell mom that immunoglobulin E levels confirm child is 4 out of 6 grade hypersensitivity to CSAME. So what is on the task like here? The second scenario will tell the mom that is urgent to mentioning that we do a test that is immunoglobulin E level that is confirmed that the child has 4 out of 6 grade hypersensitivity to CSAME. So as usual, we are starting like IRCAP, introducing myself, making a repo, taking the consent, agenda telling, attendance, and prior knowledge. So first, what is anaphylaxis? We are telling anaphylaxis is an extreme form of allergic reactions, can cause swelling in the mouth, tongue, and breathing, flushing, pass out. It is a medical emergency for which we use the adrenaline. So anaphylaxis is an extreme form of allergic reaction. We tell that, and the features also tell like swelling of the face, breathing difficulty, allergic reactions occur, and it is an emergency condition. We tell. So what we do if anaphylaxis happen? So if anaphylaxis happen, 3S, easy to remember, that is safe place, shout for help, sign for ambulance, and then use the Epipen. So 3S, remember, safe place, shout for help, sign of ambulance, and use the Epipen. So doctor, they told me that they already treated, uh, why again you are prescribing Epipen? So people who have severe allergic reactions, like what happened with Ali, are advised to carry auto-injector to be self-injected or by family members. So people who has once anaphylaxis type reaction develop or severe allergic reaction develop, they have chance to develop again. So they have to carry this auto-injector Epipen, either they use by their self or nearby persons. But we must avoid any triggers causing the anaphylaxis. Then we tell the triggers like peanut, shellfish, insect bite or stings. Sometimes there is no known cause. Also better to read the labels of any food you give him, and if he go to any restaurant, you have to inform chef about the component. So who are susceptible to anaphylaxis patient, they will avoid the trigger. So some people have food allergy like sesame, sting bite, then some peanut allergy, these are shellfish, so they have to avoid this. And if they go any outside, any restaurant outside of the country, they it is better to know the component of the food and also talk with the chef about the component of food. Now, how to use the EpiPen? So in communication, we'll draw a lippy pen, that is a pen like we'll give the pink color on the needle part and the blue on the last part, and middle expiry date, that is EP pen drawing. So it have two windows, window for expiry date and window for color change when injected. How can we use that? It is injected into the muscle of the outer thigh. It can be done through clothes. So on the outer thigh over the clothes, we can use it. How can we use that? First, we remove the blue safety release by pulling straight up, then hold auto-injector with orange tip near the outer thigh. Then push until it click. Automatic shot. Hold for 3 seconds to deliver the drug and don't rub. We say blue to sky, orange to thigh. Keep this pen outside fridge, not needed. So how can I use that? On the outer thigh, we just blue cap remove and give the orange color, the injection site on the outer thigh, and easy to just a click will be used, click will be uttered, and there is a 3 second just hold. And easy to remember, blue is to the sky and orange is to the thigh. And for its preservation, freeze is not needed. Outside the freeze, we can keep it. So what can I do in if not improved after 15 minutes? Use the another pen and call emergency because it has biphasic reactions. So nurse will give you two pens. So nurse will give you two pens. So after 15 minutes, if condition not improved, then another pen, EP pen will be used, and also call the ambulance. It seems to be difficult to me. Don't worry, we will arrange a doctor or nurse to explain to you everything, and also I will provide you with the video explaining this. So after these communications, it will be again explained by the nurse or doctor, and also I will give you some video leaflet. These are. So is there any precaution of using EpiPen? So precaution is that each time you take device, make sure that it is same brand that have had before. Carry two pens with him at any place he is in, and so device will be labeled to be used by anyone if you are not with your child, and two in the school. Make sure from time to time that adrenaline is in date and solution is clear and colorless. Make a list to the school nurse and teacher and anyone take care of the children. Make sure child wear bracelet, get replacement once you have used, and you also can make a food diary. So lots of precautions they can use. First of all, each time that he carry same brand, he will use carry two pen where he go, and his lies with the school nurse involved, and school nurse will be know if you go any trip, the nearby person will be know, and taking care that the color is crystal clear, colorless, and that is uh, then make sure child wear bracelet, and once they have used, then replacement occur, and also food diary can make the mother. So mother asked him, I am afraid from drawbacks of the adrenaline. No child has serious drawbacks from standard dose of adrenaline, but many lives have been saved. Drowsiness and palpitations. So if mother is telling drawbacks, but it is an emergency situation we use. So for that reasons, it is very much important because life is saving here. Sometimes drowsiness, palpitation is the drawback, but into emergency situation we use this. We have to avoid this drawback. What can I do if I'm in doubt it is anaphylaxis or not? You have to give the dose. So if it is a doubt, you have to give the dose. If I found the Epipen expired, what will I do? Actually, Epipen is life-saving, so we have to give even if expired, as it may only decrease the efficacy so to some degree. So if mother find that is expired, then also use in emergency situation, as it is a life-saving conditions, and sometimes it expiry date, but it has less efficacy occur. Then I will summarize what is any other concern I will ask. I will give you leaflet information and teach you about the basic like support and video links on the YouTube. I will give you emergency plan card and bracelet. Allergy to shellfish will not grow out of it. So shellfish allergy actually not grow out of it. And milk 3 to 5 years grow out. Egg allergy 7 year and soya is 10 year. So this is all about an important communication. Anaphylaxis and EpiPen. It can come. Uh, thank you very much.